there's always a little bit of apprehension if you're going to have any sort of intervention that you're not going to end up with an infection, or that it's not going to sort of adversely affect any particular part of your body. But because the procedures are so well known, because you've been doing procedures for so long, it's like anything, the more you do something, the more you perfect it. So I had a lot of faith in the procedure going okay. Well, I think the equipment was a little bit sort of scary. You see all these tubes and these, sort of like metal pieces coming out of your knee. But actually, there was very little pain. It was more sensation. It was a very strange sensation to have tissue sort of drawn from the inside of your joint. You're aware of tummy ache and that sort of thing that goes on inside your body, but not that type of strange sort of tugging sensation. It was simple, I wasn't worried about it, and I didn't have any problems, and the atmosphere was very good. Everybody was, all the people involved were very, very friendly. It all helps you to relax. And basically it was very interesting as well, because I got to talk to you and one of the technicians, didn't I, about what we were doing this for and how much of the biopsy you needed, and that sort of thing. So it was very interesting. I found it a very interesting experience. I certainly would recommend it to anybody else who is going to have to be offered this procedure. It was not painful, it was just rather strange. Certainly the discomfort went almost immediately. I did get relief in that joint. It was a little bit achy, which is not surprising because it took about an hour and a half, was it? So that sort of invasion is obviously going to leave some discomfort, but the wound healed very, very quickly, and there was no scarring or anything there at all. I'd be hard pressed now to show you actually where you actually took the biopsy.